Nick?
I'm going to talk about a lot of things. So
Yeah.
first of all, thank you for being here today. Really appreciate you. Thank you, Dr. Flowers, and the team that coordinate that. It took a lot of work to coordinate this. So my name is Nick Montasas. I'm the Executive Director for Clinical Support Services. It doesn't mean anything to you, I'm sure, right? So what do I do? So what I want to start by saying is that there are many different paths we can choose, and the folks here will talk to you about the different paths they took. It's not exactly a straight path all the time. Sometimes the path is windy. You know, there is the path where you go to school, you finish your undergraduate, you finish high school graduation first, right? You go to undergraduate, you get your bachelor's degree, and you finish in pre-med program, then you go to medical school. That's a kind of straight path, right? But nobody here took that path. They're all doing different things, but we all working in healthcare, right? I started initially as a registered dietitian. Now my job is Executive Director for Clinical Support Services. I oversee the operations of support services in the hospital, meaning not medical, not nursing. You can have services such as environmental services, housekeeping, food and nutrition services, security, things like that. The team I oversee here is radiology, lab, pharmacy, the three big departments, rehabilitation, physical therapy, occupational therapy, speech pathology, and I also oversee food and nutrition here, right? So different people will take different paths, right? So I started as a registered dietitian, but I'm now have been doing administration for a while, right? So my path was, get my undergraduate in biology, and then, continue with my master's degrees. And, typically is required an MBA if you're going to be in administration, right? So that kind of was my path. But everybody here took a different path. Now, I'm going to talk a little bit about radiology, and Christy will also represent radiology as well. Radiology has, many different aspects to radiology, right? So typically, we have, the most common ones is ultrasound and X-ray, typically. You don't typically require to go to a 4-year college degree, although some people have a 4-year college degree. But also we have CT scanners, CAT scanners, and also MRIs. So we need techs for all those things. You need X-ray techs, you need mammography techs, you need ultrasound techs, you need techs for CAT scan and MRI. So those paths are all different, and Christy can tell you a little bit more about it. But there's many different ways. I say, to go from here to Los Angeles, there's not certainly a straight route. You can go many different side streets and things like that. So I'm going to pass it over to Christy and everybody else here. They'll tell you about their journey. Thank you.
Thank you guys, and welcome again. We appreciate you coming and listening to us with our journeys, and hopefully you guys can find your journey along the way. Like Nick said, my name is Christy McManus. I'm radiology manager. Okay, so I oversee the whole radiology department. And like Nick said, it's multiple areas. We call it modalities: CT, MRI, X-ray, ultrasound, nuke med, PET CT, ultrasound. We do a lot, mammography and bone density. So if any of you have ever had an X-ray, you had an injury, you did an X-ray, you did an ultrasound, MRI, the very loud noise of the MRI, you know a little bit about radiology. You might not have known it's called that, but that is what it's called. My role here is, again, I oversee the department, but I make sure that patients coming and going get the necessary tests that they need, and the reports go to your doctor. Okay? I make sure we have the staff on hand to perform all those tests for the patients that we have here. And that's not just in the hospital, that's the emergency department, that's our outpatient, all the clinics that you've seen in the video. We supply staff for all of those areas. The reason I chose radiology, I had a different path. I thought I was going to go into a different path like nursing, but I thought that's not for me. After I saw the bedpans and everything else that were involved in that, I decided that wasn't for me. I had a couple X-rays from injuries in high school, and my senior year I decided I wanted to go into X-ray. So that's the path I started with. I only went to a 2-year community college, Crafton Hills up in Yucaipa, and then I transferred to Loma Linda. And from there my journey started. I got my license in mammography, and I did mammography, specialized in women's health for 25 years before I became a manager. So my journey was a little different. Like Nick was saying, you kind of feel like you might want to do something, but we suggest you volunteer, talk to people in that field before you make that decision. and then really decide from there. And it's not too late if you're already a senior, because you got to do all your prerequisites before you actually get in the field of choice. Okay, and a lot of those prerequisites go for all the fields, whether it's nursing, pharmacy, radiology, physical therapy, any of that. It's all your basic prerequisites of classes, okay? And then what do I enjoy most about it? I love helping people. I love the fact that someone comes in and I see them in the hallway, and I might see them a couple times because they come in through the emergency department, and then they become an inpatient and they come down for more testing, and I see them again and I ask them how they're doing, and they will tell me how the staff has treated them, and I know that with us, we're helping them get the proper diagnosis and treatment they need to feel better, and then eventually get discharged, and then they're, you know, hopefully they're better along the way. What would I tell my younger self if I could do it all over again, or where I would go? I wouldn't change anything. I enjoy the path I went. I enjoy being involved in women's health as long as I was. I enjoy the patients that have meant so much to me, and that, you know, I can look back and say, I remember Mrs. Smith. You know, I remember she had breast cancer. She came back and she's still living today. You know, we helped diagnose that. So these little things are going to be along your journey will mean something, and know that you chose the right path. And I went back and I went to school and got my master's degree, and that's why I'm in this role I am today. And I really do enjoy it. So I hope whatever journey you guys pick, that you know that it's the right journey for you and you're passionate about it. You look forward to going to work every day. I do, even in this role now, even though I'm not directly in patient care, I oversee it, and I make sure the staff that are involved with patient care hopefully have the same passion I do, okay? Because we're all here for the patient, the bottom line. Thank you, guys.
Good morning. I'm Cedric Bull. I'm the Director of Clinical Laboratory Services here at RUHS. Been here for almost 15 years. And my role now, well, I started off as a bench tech, and then I worked my way up and become the top dog there in the laboratory. What I do there, I pretty much direct and drive the goals and initiatives of the laboratory, making sure that we provide the services needed. So if you ever go to a doctor's office and you need to get some blood work drawn, where does that go? It goes to people like me who go and analyze and provide the reports for the physician, so then they can see what's going on inside of you. So it's not only blood, but we also look at your urine, we look at your stool, we look at your anything and everything that's inside of you. So we get to play with the nasty, dirty, crazy things, but we enjoy it because it, for us, we like to help people, you know, and we provide the science behind some of the miracles that happen here on the campus, right, in a hospital. And what led me to go here, be honest with you, so when I first started in school, I was a pre-med music major. I was actually, for a long time, I was a concert pianist and saxophone player, so I did a lot of concerts. I really worked myself up in the music area. I started that off my first year, and then my father, he was a clinical laboratory scientist for many, many years. And he took me one day, he said, what happens if it doesn't work out getting to med school? Are you going to be able to survive with music? So I had to really think about that. And so I remember as a kid going into the laboratory and looking at the microscopes and all the culture plates, and I was like, oh, that's really cool, you know? And seeing that in high school in biology, chemistry, physics, I really enjoyed physics. And so I decided to change my major, and I was kind of regretting it at first because there's a lot more math and science. And then I took an intro course into medical microbiology. And the professor there really inspired me and got me into what my dad enjoyed, and that really drove my experience. And I went forward with clinical laboratory science, and it was a little bit of a journey, but I was young, I had the energy, and got through it. And I was still pre-med, but at the end of the day, I chose to stay in the laboratory profession because I enjoyed the work. And it kept me busy, kept me focused on many different things. So I could either look at slides, I can do some chemical tests, I can do blood bank tests, I can do everything. It's what we call generalists, right? We rotate on different areas and disciplines, and we get experience, and we're actually masters at every single area of the laboratory. And that is something that I really enjoy doing, because I have a variety of things that I can do and play with. So, and as my role now, I'm able to provide guidance and to all the healthcare professionals. I do a lot of we look at key performance indicators to see how the laboratory is doing and see how much we can do. So what I enjoy most about my work is that we help people. Okay, we're the people behind the scenes, what happens around in healthcare, and also the people around us as well. In the laboratory, we're very special, weird people. Because you don't get a lot of people who want to sit in front of a microscope 8 hours a day looking at slides, but we enjoy it. And what would I tell about my younger self? The journey I went through, I got to experience, and I actually went through different states, looked at different laboratories and the way everything's practiced, and it was a good journey for me. I really enjoyed it. And laboratory professions is an interesting area. There's here at RUHS, there's 10 different areas, 10 departments within the laboratory that we oversee, and everything is unique, but they all work together, like one big cog in a wheel that keeps turning, all right? And so that's a little gist of laboratory professions. Okay.
Thanks, Steve. Hi, everybody. My name's Alex Tiesh. It's not Johan and Jetty. That's not me. Alex Tiesh. I'm one of the senior lead therapists for rehab department. I'm a physical therapist. As a lead physical therapist, I kind of have one foot in two different places. While I do patient care, I'm also involved in kind of administration with the department as well, helping the department run smoothly. I act as a liaison between the rehab department, all members of the rehab staff, and the rest of the hospital. So physicians, nursing department, we speak with case managers about discharge planning, and then patient families as well. And so I work kind of on both sides of that. What led me to choose this discipline, it's probably not as romantic as most physical therapists. So a lot of people get into physical therapy because they had an injury and they worked with a therapist they really liked. Or people who are very athletic who do a lot of working out, they tend to go into physical therapy. It's very common. For me, it was I knew I wanted to do something in science. I took a lot of science classes, and I met someone who told me they were going into physical therapy and all the classes they took, and I said, I already took most of those classes. Why didn't I do that? It worked out pretty well. So I'm glad I went down that path. So when I went to school for physical therapy, it was when the doctorate of physical therapy program was just emerging, and so they were kind of pushing out the master's program and wanting everybody to become a doctorate level. And at that time, the program that I went to was at Loma Linda. It was called an entry-level program, entry-level doctorate, meaning you did not have to have a bachelor's degree before you started the program, and when you graduated, you have a doctorate of physical therapy. I believe that's changed now, so they don't have that entry-level program, so it's still required for you to get a bachelor's degree, and then you go to PT school, which is usually a 3-year program, and that's a doctorate program. Occupational therapy is, I believe it's the same now. They were a little bit slower adopting the doctorate program, so they might still have some master's programs available, but I believe they're also pushing towards the doctorate level as well. I don't know as much about speech language pathology, but I think they're also taking a similar path. Right now, they're mostly master's programs, but I do know that they do have a doctorate program that a lot of schools are initiating. So what I enjoy most about physical therapy, and I work primarily or really only in the inpatient department, so I see patients who are admitted to the hospital. And we see all diagnoses there. We see, of course, traumas and orthopedic injuries, but we see medical patients, patients who are on comfort care. You see the whole spectrum. And what I really enjoy, especially with some of the trauma patients or patients who come in with stroke diagnoses, when we come and see them, usually they're at their worst, mobility-wise. So patients who are barely able to roll from side to side. And often by the time we're done with them, they're able to get out of bed, they're able to get up and walk, and so you see this really, really fast progress with them, which can be really rewarding. Patients who maybe thought they would never walk again are up and taking steps, a couple days later. We also work very closely planning the discharge process for these patients, so telling physicians and the patients what we think will be their best location to discharge to when they leave the hospital, where they're going to get the best care, where they have the support they need, whether that's at home or another inpatient rehab facility or anything like that. Telling my younger self, I guess I would say, and this is true of I think all professions within the hospital or medical professions, is that with any degree that you get, there's a very wide range of jobs that you can have, and so don't feel that one degree is limiting you what you can do. Even within physical therapy, there are many different paths that you can take. You can work inpatient, you can work outpatient, you can do consulting services for ergonomics. There's just many things you can do. Even more so within nursing, just so many different things you can do. So you want to be a nurse, but you don't want to work with the bedpan, there's a path for you still. There's other things you can do that don't involve that. You might have to pay your dues, but you can get out. You can do other things. So yeah, don't feel like any one path is limiting you. Many options still available.
Hi, I'm down from pharmacy, so I do work at the pharmacy downstairs. It's a clinic pharmacy, outpatient. The pharmacy department has like a lot of different sub-departments. I work in outpatient or retail, sort of like similar to like the CVS Walgreens you're used to, but we do cater to our patients that see our doctors here at the clinics. And then we also have a pharmacy in the hospital side where we do discharge meds to make sure when patients get discharged, they do go home with the medications so they can continue their medications while they're at home. So my role as a pharmacist, pretty much we just want to make sure, you go see the doctor, you go to the hospital, first thing you get is a medication. So we want to make sure it's safe and effective for you. Personally, everyone has their own, different health or different age. We have to make sure everything you get is safe and effective. So that's our main goal. What led me to choose this? I actually, in my high school, we had a healthcare class, an elective class, and I was able to go to 4 elective externships at the end of it. One was pharmacy, had radiology, occupational therapy, and then outpatient surgery. And then honestly, pharmacy just seemed the most interesting. At the time, it was the least amount of schooling, but they did actually increase the schooling. So now to be a pharmacist, you do need a bachelor's degree. And then when you go to pharmacy school, it's another 3 to 4 years. So I did an 8-year path to become a pharmacist, but I did major in sociology. I had thought I would be a social worker. That was sort of my path in the beginning, but just thinking more about it, and I still do watch Law and Order Special Victims Unit, and the more I saw the emotional toughness you need to be like a social worker, it just didn't seem like that's something I could do on an everyday basis. And then since pharmacy was something I did see in high school, it just sort of was always in the back of my mind. So I sort of stuck with it. But even though I majored in sociology, I just took the prerequisites I needed to apply to pharmacy school. And so then I went to pharmacy school after that. So you don't technically need that straight biology major or pre-med. You can go any major you want, but as long as you have the prerequisites, you could go to pharmacy school. So that's what I did. What I enjoy most about my work is that it's fast-paced. Every day may be a little similar, but every day is different. We do a lot of problem solving, a lot of back-end work. There's a million medications. People don't realize, they cost millions of dollars and they're not covered by insurance. So we have to do a little work on insurances with patients, with doctors, to find out the best medication for someone and that someone can afford or that's covered. So that's what I like about it. And then, like I said, when you go to the doctor or the hospital, you get a medication. So you're a part of a patient's healthcare journey a little bit if they don't realize it, but you're always sort of in that. So you feel like you are making a difference, and that's what I enjoy most, especially when patients do tell you that they thank you for taking the time to go over the medications, listen to their concerns, and actually come up with a solution. And they are grateful for that. So you get that here and there every day at work. So that's what I enjoy most about it. And then what would I tell my younger self about healthcare careers is just to research it all. Like I said, I went to that class and I had 4 options and I sort of just picked one. So I would just want to make sure to know about all your options and see what fits best for you or what you would think you would love most, because when you're in the profession for a few years, there's burnt out, you sort of don't love it as much as you thought you would. So I think what's best is just to make sure you know of all your options and see what you think would be best.
Thank you.
Thank you.
Good morning. My name is Cassandra. I've been a licensed pharmacy technician for about 6 years now. My roles are I intake prescriptions, we type, we bill insurances, we fill prescriptions, we interact with the patients. What led me to choose this, I actually went to school to community college for medical assisting. I got my associates within 2 years. But I had started off as a clerk at CVS. I was a cashier for about a year. And the manager there actually pushed me to do, to transfer into the pharmacy. So I completed 220 hours, got my license, and I just stayed in the pharmacy. I really wanted to know what pharmacy was. I had no idea what pharmacy was. And being there, working there, I learned how to pronounce medications. I knew what they were for. And I was there for about 5 years before I came here to Riverside University Health System Pharmacy. The environment's different. I love it. And, you know, even then, right now, I do consider changing and going into nursing. What I most enjoy about working in the pharmacy is I get to interact with the patients. And I think that's what led me to choose going into nursing now. And what I would tell my younger self would be to take the risk, the opportunities. Some things may seem scary, but you know, if you take the risk, even then you get the experience. And yeah, that's it. Thank you.
So thanks everybody for sharing your pathways. I think what you heard similarities that they started one direction and maybe you pivoted. So understanding that can be your future too. Having an idea and something else might come up that you find is better for you. And the other aspect that you heard a lot of them talk about what they enjoy about is taking care of patients. And that's, I think, the core of what we're talking about. So we've got another group. I don't know.
They're not all assembled. You've got a little.
They're not here yet.
Yeah.
So a couple things I wanted to ask is, number one, Alex, can you talk about the differences what a physical therapist does and what an occupational therapist does?
Sure.
So technically, physical therapy is focused more on motion and movement of the body, and occupational therapy really focuses on activities of daily living. And so activities of daily living includes things like dressing, bathing, but can include higher cognitive things like managing finances or grocery shopping, things like that. And so we do overlap in a lot of areas, especially in the inpatient world, because you have to have that basic mobility before you can perform your activities of daily living. But that's kind of the big, aerial view of the two. Is one is focused on mobility, and ambulation tends to be the big one with physical therapy, and occupational therapy is a lot of hand-based movement and, like I said, activities of daily living.
And there's one other therapy, is speech therapy, and a little bit about what they do.
Yeah, so the speech-language pathology is part of rehab, although they're probably the most different out of the three of them. And so especially in the hospital, what they focus on a lot of is swallowing ability for patients. So a lot of patients come in, especially, let's say, your stroke patients or patients with cranial nerve injuries who have difficulty swallowing. Maybe they can't move the food around their mouth properly, and so they're at risk of that food going down their trachea into their lungs instead of into their stomach. And so that's a very dangerous event. So they're really focusing on making sure those patients get their food down the right pathway. They take a look at different food textures and which one that patient is most easily able to swallow or move around. They do different diagnostic tests, so they'll go down to radiology and they'll use the X-ray fluoroscopy down there where they can actually visualize food in the patient's mouth and see where it's going down. They also use cameras that they'll put up through your nose and look down into your throat, and they can watch you while you're swallowing and see exactly where that food is going. And they can make recommendations based on how that patient is moving and swallowing that food. That's a big part of what they do. They also work on cognitive rehabilitation with patients as well. So trauma patients who have traumatic brain injuries and stroke patients, they do a lot of cognitive work with them as well.
And thanks, Alex. So Christy, the other thing, can you describe to the students a difference between a CAT scan and an MRI and a plain X-ray? Because those are all different tests that they might not.
They definitely are. So an X-ray, we'll start at basic level, if you had an injury, you came in through the ED or to your doctor, you had an x-ray order because you hurt your wrist. Well, they're going to order an x-ray, make sure it's not fractured. It's just going to show bone. And then from there, your injury's not getting better. Maybe you're going to go to physical therapy to try and make it better. But they want to make sure that, you know, you don't have any muscular damage, any tendons are damaged. If that's the case, you're going to go to an MRI, because MRI will be able to show the soft tissue. It shows bone as well, but it goes into the tendons and ligaments and muscles more so than bone, okay? Now a CT is different, as if you, say you have abdominal pain, your stomach is hurting, they don't know why. They might give you some oral contrast to drink, and they're going to be able to see your digestive system when they do a CT scan. Think of your body as a loaf of bread. They're going to scan you, and it's going to be in slices like this. They're going to take that information, and they're going to be able to see what your liver looks like, your kidneys look like, your bladder, and if anything is obstructed, they're going to see it on a CAT scan, because a CAT scan shows it's a form of x-ray, so it is radiation, but it shows your digestive system in very detailed form. So your kidneys, again, your liver, if you have your gallbladder, and all the way down to your bladder. So make sure that your body is functioning properly. Okay?
Thanks, Chrissy. So we've got a new group coming in. Nick, did you want something else you wanted to say, though?
One thing I want to say is that if you get anything from this, is that in the hospital, we don't work as individuals. We always work as a team. So when we provide care to the patient, it's a team effort, right? So you have a physician, you have a nurse, you may have somebody from radiology, you certainly will have, you know, lab results, you know, you probably will need to see an occupational therapist, physical therapist, or a speech pathologist, and you certainly will get drugs, and somebody has to determine that they're all provide quality care and it's safe for you. So it's all about teamwork. So we like to work with others, you know, so we play good in the team.
Excellent. That's great. It takes a village.
Yeah.
So anyway, let's give everybody a hand, and we'll get our next panelist in.